Sexual violence is prevalent throughout all of our communities. A victim can be of any age, gender, ethnicity, or economic class. Each victim's experience in assault is extremely individualized. But what is universal is their need to be treated with dignity and respect, all while voluntarily participating in a forensic sexual assault medical examination. The medical profession has made great strides when it comes to providing victims of sexual assault with the best possible care with the development and training of sexual assault nurse examiners, also known as SANEs. The use of these highly skilled and specialized group of nurses has become the gold standard when it comes to performing these types of exams. Unfortunately, many communities are without access to sexual assault nurse examiners. Until then, adult victims of rape will receive their forensic examinations at local emergency departments. Having a basic understanding of how to perform a proper forensic sexual assault medical examination is crucial for any medical professional working in an emergency department. Acute victims of sexual violence, individuals assaulted within the previous 72 hours, may present at the emergency department in several different ways. They may come by themselves, with friends, or family members. They may be escorted by a sexual assault advocate from a local rape crisis center. A victim may also present accompanied by a local law enforcement officer. No matter what path leads the victim to your emergency department, treating them with compassion, understanding, and professionalism is a crucial component for each forensic medical examination. When a victim of sexual violence presents to an emergency department for an exam, it is best practice to move them to a private waiting room or exam room as soon as possible. Most victims feel extremely exposed and vulnerable after an assault. Having the victim avoid waiting for an examination in a community space will help to cultivate a sense of rapport with the medical staff and a feeling of safety and security for the victim, especially if they are being escorted by a law enforcement officer. This is very important since the victim will be asked to share details regarding their assault with the medical staff, and they will undergo a physical examination that has the potential to mirror the trauma that they just experienced. Sexual assault forensic examination kits are provided at no cost to emergency departments by the Arkansas State Crime Lab out of Little Rock. These basic kits provide the medical professional with essential steps to collecting forensic evidence after a sexual assault. The manner in which this exam is performed will create a lasting impact on the victim. At any point during the examination, the victim has the right to refuse any parts of the exam and/or evidence collection, as well as the right to stop the examination entirely. This exam is completely voluntary and under no circumstances should the victim be made to feel otherwise. It is recommended to advise the victim before and throughout the examination of their right to stop at any time. It is important to communicate this sense of control to the victim since so many circumstances leading them up to this point have been out of their control. Let the victim know that you will explain every step of the examination before you complete it so they will not be startled. It is also best practice to offer to contact a local sexual assault advocate for the victim if that resource is available in the community, and if they are not already involved. An advocate will play an essential role in the long-term care of a victim of sexual violence, as well as providing emotional care and support during the immediate medical examination. It is highly recommended that a sexual assault advocate be present during the exam, but this decision is ultimately left to the victim. The advocate's role is to provide emotional support, professional advocacy, and follow-up resources to the victim as desired. The advocate does not participate in any part of the investigation or the collection of forensic evidence. It is the medical professional's role to carefully collect evidence and provide medical care for the victim in a supportive, compassionate environment. Included in the forensic examination kits is a guide for obtaining an appropriate history from the sexual assault victim prior to the examination. This will allow the medical professional to assess where on the victim's body evidence may be collected. The victim's body is a crime scene. Preserving the evidence is an important part of solving the investigation. Follow the instructions on the sheet while maintaining a judgment-free demeanor and providing a safe and compassionate environment for them. It is very important that the only information documented comes directly from the victim. When gathering evidence for the forensic examination, keep in mind the idea of least invasive to most invasive. The next step is not specifically included in the forensic examination kit. This step involves collecting the victim's clothing. If the clothing worn by the victim was what he or she was wearing during the time of the assault, place a disposable drop cloth on the floor of the exam room. Have the victim step onto the drop cloth to disrobe. If you have an advocate present or another nurse, please use another cloth to provide a sense of privacy for the victim during this part of the exam. Have the victim hand each article of clothing to you individually. With gloved hands, place each item in a separate paper bag. Once the victim's clothing has been collected, have them put on a gown and sit on the exam bed. Carefully perform a head-to-toe assessment, providing them with as much privacy as possible by sectioning off exposed areas. Any injuries noted should be photo documented. With each injury, a set of 3 pictures should be taken, one for anatomical identification, one with a ruler, and another close-up of the injury. During this assessment, like all others, talk the victim through what is being done and remember to ask their permission throughout the process. Once the head-to-toe assessment is completed, the victim should then be placed in the lithotomy position. You will then perform a pubic hair combing by first placing the provided paper underneath the victim's buttocks. Remember that explaining this process beforehand will reduce the anxiety of the victim. It is never acceptable or needed to pluck a victim's pubic hair. If the victim does not have pubic hair, simply visualize the area for any possible hairs from the offender or other foreign DNA, as well as any obvious signs of body fluids. The final 2 parts of the examination are the vaginal or penile swabs and the rectal swabs. If you are not a SANE, these 2 steps will need to be performed by a physician. There are 4 vaginal or penile swabs. On a female victim, use 2 swabs for the outside of the vagina, moving the labial folds to swab for evidence. Again, always talk to your victim and prepare them before touching them. Use the second set of swabs for internal vaginal collection. A speculum may be inserted at this point for more effective swab collection, but it is not required. If there is vaginal injury, do not attempt the speculum insertion. This will only cause severe pain and possibly result in further injury to the victim. Lubrication may not be used on the speculum because it has the potential to contaminate the evidence. Visually look for any abrasions, tearing, or bruising externally and internally. When doing the penile swabs on a male victim, use the swabs one by one and cover the shaft and head of the penis, making sure the entire area has been swabbed. Do not insert the swab inside of the penis. This portion of the exam has the potential to be extremely emotional for the victim. It is imperative that the medical professional walks the victim through the process and is aware of their emotional state. Allowing them to stop or take a break may be needed. The final step of the collection process is the rectal swabs. This is a very important part of the examination, even if the victim does not disclose that any rectal penetration had occurred. Have the victim continue to lie on their back, and if physically able, have them gently pull their own legs up to their chest with their knees bent. Take the rectal swabs and roll them on the inside of the anus and then slightly insert the tip of the swab on the inside of the rectum. Once the exam is completed, allow the swabs to dry completely. You may use a swab dryer if available, or simply flip a disposable cup over to act as a drying station for your swabs. Remember to label everything and do not mix up the swabs or allow the swabs to touch. The victim may now get dressed in new clothing that they have brought themselves or ones that have been provided to them by the advocate or the hospital. At this point, prophylactic antibiotics to prevent sexually transmitted infections and emergency contraceptives should be discussed with the victim. The victim has the right to choose to refuse or accept the medication. Once all the evidence is dry, place in the corresponding envelope. Once the envelopes are correctly filled out and sealed, place them back in the forensic evidence collection kit. Fill out the front of the kit and sign, date, and time record only when you are handing it to the investigating officer, who is now taking the evidence into custody. Many times, the sexual assault examination is the only potential piece of evidence from an assault. The need for professional, competent, and compassionate personnel to perform these examinations is an unavoidable reality for many emergency departments. Providing these examinations are not only about collecting the evidence, they are also about preserving the last amount of dignity a sexual assault survivor may have after an assault. Please invest in organizational and/or individual education on providing proper and effective forensic sexual assault examinations.
Well, the forensic examination itself is important because you're looking for any evidence that you can find at all to determine if there's anything out there that can corroborate what the victim has said. It can be just as important when you have a trained nurse who has, by training, experience, education, if there isn't anything that shows up. Because as long as that nurse is doing her job and doing it correctly, she can explain to the jury the procedure that she follows, why it's the correct procedure, and in the absence of any physical evidence or forensic evidence that can be found, why that doesn't necessarily mean that nothing happened and that the victim's story can still be accurate. If the collection and the procedure that the nurse is following is done incorrectly or done poorly, certainly that will be exploited at trial. The defense attorney can cross-examine the nurse and bring out all the reasons that it was good procedure was not followed, and that can always that hurts the credibility, which is why any education, any training is very valuable when you want a nurse that's on the stand, and it goes to credibility. If a nurse can, when she's being introduced to the jury, and she can explain to the jury all of the training that she has had, all the education she's had, she's basically testifying as an expert anyway, because this is a specialized field. Very few people know about it, certainly very few people do it, rape examinations. So it's vital that the jury gets to hear that that nurse, that witness, has a background that gives her credibility to show the jury that she knows what she's talking about and that she's doing it correctly, because there are other people out there that will be able to inform the defense of this is really the proper procedure and here's the procedure they followed, which can exploit a weakness, damage the credibility, and hurt the case, even if something was found. I think it's really important for any nurse that's going to do sexual assault examinations using rape kits and doing that type of work. It's important that they don't wait on the education and training to come to them. They need to search it out. And the Arkansas Coalition Against Sexual Assaults, their website has links to a lot of education material, also training material on that website, as well as they're a great place to go to find where training may be coming up. You've got to be trained when you're doing a job as important as this. You have to have good training.